Okay, this is a shave biopsy on a familiar patient from earlier. And we have something right here on her forehead that's kind of a warty, rather hard growth. Not like a nice benign seborrheic keratosis that many patients get, although it may very well be. We've already used betadine to work as an antiseptic on it. And then we need to numb it up, right? You want it numbed up first. You do, believe me, you want it numbed up.
I do.
So,
I do.
So what we're going to do is go numb it up. Let me, actually just come on with me and let's put out a pair of gloves, sterile gloves for me to put on. Size 7. I have small hands. I'm proud of it.
Okay.
You're laughing. I have small shoes too. Okay, so you guys hear all that laughing? She laughs at the funniest things. Okay. Oh, that's right. Don't get any of these people in it, nor any patient information. Yeah, just the person drawing up the medicines. For this procedure, I like to use lidocaine with epinephrine with bicarbonate. And here, I'll block the peanut gallery with my back there. Lidocaine with epinephrine is the anesthetic, and read any comments that come up, that works very well to numb it up and to help keep from getting lots of bleeding. We don't like lots of bleeding. And it helps to numb it up better than lidocaine without epinephrine. Actually, I'm going to go ahead and do something else. I'm going to go ahead and draw up just a little bit of bicarbonate because it helps to keep it from stinging. Lidocaine by itself naturally stings because it's very acidic.
Are you not freezing it?
No, this one we're going to shave off and send for a biopsy to find out for sure what it is. If it turns out that it is cancerous, we'll have to do a secondary procedure, a full excision. Okay, so we're going to throw these away in the room. So come with me. And the reason we're doing this, needle size, smallest we have, 30 gauge. Was that you that asked or somebody on?
Somebody else.
Oh yeah. Okay, so let me get some gloves on for the giving the injection, and then I'll get sterile gloves on after for doing the procedure. And the reason I don't just do one pair of gloves is because this isn't sterile. Well, the needle is, not the syringe. Okay. Get that little bit of air out of there. Okay, sorry to leave you for so long. We're going to go ahead, I'm going to touch you outside of the area that we prepped and give you a shot. I'm sorry. It stings, even though I did put the bicarbonate in, it still stings. And it's hard with the coloring from the antiseptic, but normally you'll see the skin blanch a white color as it gets full of the lidocaine. And that can happen even without the epinephrine, but the epinephrine has an additional effect of closing down all the blood vessels, constricts them, and that way you don't have as much blood coming in, so there's not as much bleeding.
Good.
But also it helps to keep the circulation from taking away the anesthetic, so it lasts longer. And then I'll take that out. This is a special syringe that allows you to cap the needle, or not cap, but protect it from accidental poking. We don't want to have needle sticks. And then I have to get on my sterile gloves. And the procedure is going to be done with the blade there. That's called a biop blade. It's a real flexible razor blade. And there will be some bleeding. And that's what we're going to use the magic wound seal for. This is going to turn into a wound seal ad, I think, by the end. Because every time I do this procedure, I end up sounding like an... Oh, full disclosure, I am not paid by Wound Seal.
Okay, is that a mole that's changed shape or color?
Shape or color? Both, huh? Because it's relatively new.
I wouldn't have thought of it as a mole, to tell you the truth.
Well, it's not like a regular mole, but
No, but it has changed shape.
but it is a changing skin lesion.
Yes.
All right, so those of you who are squeamish, turn off now. What we're going to do is shave right through where we numbed it up and get under the lesion, through the skin.
I can't hold my head still, Mark.
Can you tip it back just a little? just like that, while I put the lesion, the specimen, into a container and then throw away the blade and then come back. And now at this point, we're going to do a little dance of exchange because you need 2 free hands, right?
Yes.
And I only need 1 free hand.
Well, I could do.
So let's do this. I will take this.
Okay.
So I can do all my work with this hand in the sterile field. And then we will need you to tilt your head just a little bit further back because this stuff is going to, it's a powder we put on. It's called Wound Seal.
Okay.
She is so pretty and classy.
Mm-hmm.
All right, there you go, just like that. Pour it on. And then I put pressure on for about 60 seconds. Somebody says this is the best live show ever.
Awesome.
This is the boring part. This is where I just hold it for 60 seconds. And so I count in my head. We're about 10, 12, 13, 14, 15, 16, 17, 18,
How is
19,
this legal?
20,
Somebody asked.
21, 22. How is it legal? 23, 24, 25. Because she gave consent.
Ask no
28,
questions.
29,
That's how it's legal.
31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45.
Can you
46,
get that over the counter?
47.
The
I
powder?
don't know that you can. You can
Wound
look for it.
seal.
It's called Wound Seal. They're somewhere in the low
We need to be
50s.
on that doctor's show. That's awesome. I'm sorry.
Actually, there is somebody on that show, Dr. Jim Sears. He's a pediatrician.
Uh-huh.
He and I were in the same class in medical school. And Jim, if you're watching, answer my emails. All
Somebody
right,
said
there
they're
we go.
starting a medical practice on Periscope.
And there we go. Look at that. See, oh, the powder's kind of dipping down, but there's no bleeding. This stuff is a brown powder that interacts with the wound to become a solid barrier like a scab. It's like an artificial scab. And so she already has her scab in place. This corner is not clean.
Right.
That's how I tell people, don't use that for any sterile materials because Jessica's going to do the rest of the dressing on the wound.
All right.
And we're going to go to the
Calm
office.
And TV ready.
Well, thank you. I appreciate it. They're talking about you. You are cool, calm, and TV ready. And I'm going to take my leave.
Okay, Mark.
We'll get back together next time. Thank you.
See you.
Thank you both for helping with the Periscope.
Uh-huh.
And thank you, viewers, for sharing and for following. If you don't already follow, swipe right to follow. And we will do it again next time a patient wants to show you what's going on. She's my hero. P.S. Get a release for after she becomes a star. I think my release is just good for this one episode. Ask the Doctor later. Have a about mole. Love this. I'm glad you guys like it. As far as the consent situation, I can't show you my getting the consent because I don't have consent yet to get get it on camera. So that's why you never see me getting or obtaining the consent. I do that before we start the Periscope. So just to clear that up. Oh, we are going to have a session on Google Hangouts at noon Pacific time. And I'm not sure how you find it. It's under my name, Mark Vaughn, and we're trying to get a couple of other Periscope doctors to join us. One of them being Neil Flock from Connecticut, I believe, and also Dr. Brombot from Florida. How long does it take for a mold to fall off after freezing? After freezing, it happens just within a week's time, usually, at most 2 weeks. Verbal permissions should suffice. We hope so. And actually, I go ahead and get written signed consent just to make sure. It doesn't hurt. So if you guys do want to follow on Google Plus or Google Hangouts, look for me, Mark Vaughn, put me in your circle. I think it should have my picture. It looks something like this, and we'll see how that goes. So until then, stay in good health.